Hi, ma'am. My name is Aniela Ramirez. I'm a licensed clinical social worker who received your referral to our agency, and I will be meeting with you today to go over what's been going on and what the concerns are. So let me first explain that I am bilingual and I am here to communicate in whatever language is most comfortable for you. So if you need me to speak in Spanish or try for you, I'm able to do that.
English is fine. I understand.
Okay. So my role is to support you in your overall functioning, your well-being, and your mental health. And I want to also partner with you and know that it's a joint effort and ongoing process so that you're aware of that.
Yes.
My role. And your role is also to be open to feedback and willing to work with me in a team effort. I also want to let you know that whatever's disclosed in this room remains here and it's private information as long as it's not a danger or a threat of harm to yourself or others. And so in that event, I would have to disclose that information.
Yes.
Okay. Now, if this is out of office hours and you have an emergency or crisis, I just want to make sure that you have a plan of who to contact. If you need immediate medical attention, I would call 911, or if it's an emergency. Otherwise, just contact whomever you can immediately use as a support system, like your wife or others.
Okay.
Then I also wanted to discuss your understanding of why you're here.
My wife made a referral because I'm not doing as well as I should be.
Okay. And so, according to your wife's reports, she's reported to me that you are having mixed episodes of elevated mood, which is called mania, and also depression. Low energy and so forth. I wanted to ask you of your past history of medications. Are you currently taking anything other than what I have noted here as the lithium 800 milligrams twice per day?
I am only taking it once per day.
Okay.
That's it.
That's all. Okay. And so I also have your responses here that I have gathered, and on the Morski 8 scale, your responses show very low adherence. So that makes sense that you are not achieving the therapeutic effects of this medication because you're not taking it as prescribed. Just so that you are aware also that this is around an appropriate age of diagnosis. I see that symptoms began for you about 4 years ago. You are 32 years old, and so the average age is 25. Because of your low adherence, I would want to incorporate a tracking mechanism where you can note daily how often and when, the frequency and time of day that you're taking the medication and what it does for you, what you notice, any changes in your behavior, any side effects, and then we can discuss this in counseling.
Okay.
So in that, please keep track of your sleep schedule, your mood on a daily basis by scaling it on a 1 to 10 scale, 10 being the best and 1 being the lowest, and also how you're doing, so forth. Do you have any concerns?
Yes, I want to know how the medication is affecting my body, or how it works, or side effects maybe, or...
Okay, we can definitely go over that so that you're aware. With your age, medication is metabolized a lot quicker, and so when it enters your blood, first it enters your stomach and your intestines, and it travels through there. It is going through a process of absorption, and then it's just being distributed, metabolized, and later you'll excrete it through, release it through your pee and urine. That process, it's important to maintain a constant level of the medication in your bloodstream so that you can receive the desired effects and therapeutic effects. That will help with the chemical imbalances that are going on in your body and your brain. We have these signals and messengers that communicate, and sometimes we will have increased or decreased levels of these neurons. They're these chemicals that send messages throughout our body, and sometimes the medications can either block that process of releasing them in our body and bloodstream, or it can also help absorb it. So that you are aware also in this process that majority of people do not have side effects from taking lithium. But some people who have reported side effects, indicate that they have stomach pain, digestion issues, sometimes nausea. There is thirst, increased thirst. So they can subside with diet and making other accommodations. Just also that you're aware, this is the 6th leading cause of disability in the world. So you're not alone. And, I'm here to help you in any way get to the optimal level of functioning. Do you have any questions?
No, I'm looking forward to working with you.
I am as well, and as long as we can come up with a plan and we stick to it, I think that you'll see that your life will dramatically improve.
Okay.
Thank you.
The only thing that we didn't talk about was, I guess I don't need to bring up about you said episodes, but...
I didn't talk about his information on his case.
Yeah.
I think I tied it in enough to the medication, the process, what I'm here for, the main issues, how it works.
Yeah.
Being culturally sensitive. Yeah. That may be the only really ding is you didn't talk about his personal details.
Yeah,
But it was very hard to do everything in 8 minutes.